now, without further ado, it is my pleasure to introduce today's first speaker, Zach Lewis, Senior Vice President of Ipsos's Public Affairs Research Team. Zach, you have the floor.
Thanks. So thank you everyone for joining us today. Communicating information and recommendations in public health and other topic areas in order to influence behaviors and decision-making is a challenge for agencies and organizations in the best of times. You're often attempting to influence behaviors that are rooted in deeply held habits that can be hard to change. Decision-making isn't always deliberative, and even when it is, there are a number of factors that contribute to it and influence it beyond those that you may have immediate control over. And it can be difficult to get people to focus on information and communications when there are so many different demands on their attention. So, when you're actually attempting to do public health communications, or again, communications in other domains, you're often not working in those best of circumstances where those are the only challenges you face. You may only have partial information, or recommendations may not reflect a consensus within the relevant epistemic community. There may be vested interests that people or organizations have in rejecting recommendations or new information, and the reactions to what you're communicating may be shaped or may be informed by a pre-existing hermeneutic of distrust or suspicion that the audience has. So given all of those factors, it's especially important to make sure that communications are rooted in sound understanding of the context and the behaviors and decision-making that you're attempting to influence. So today we'll talk about a few ways that you can use research in order to address those challenges and obtain the information that you need to shape communication strategies and messaging, and refine that and understand how it works in market. So I'll start off by talking about communicating in a time of reduced trust. We find that the COVID-19 pandemic has reinforced the need for effective communications and revealed how important trust is for engaging the audience and achieving the objectives of communications. Sharing information is key to many agencies' missions, and that can take the form of providing general information to the public, encouraging healthy or otherwise prudent behaviors and decision-making, and providing services more effectively, engaging with those groups that you're trying to provide services to. When the public's trust for an agency declines, all those missions can become more difficult to implement. And I think the pandemic reflects a key case study for that. But we shouldn't think that this decline in trust is merely a recent phenomenon. This is a topic, confidence in the federal government, trust for different forms of authority, that's been tracked by a number of organizations for many years. And we see a consistent or a continuing decline in the public's trust for both the executive branch of the federal government and for Congress over time. Although there have been fluctuations at various points, there's definitely been a downward trend for both of those. And that affects how agencies within the executive branch are perceived, and people's willingness to attend to the information that they're sharing. The decline in trust, or the level of trust across different federal agencies, isn't consistent, or you can see variations. So we recently at Ipsos explored the trust that the public has for information, news, or guidance from 5 different federal agencies: the Food and Drug Administration, the Centers for Disease Control and Prevention, the Department of Transportation, the Department of Veterans Affairs, and the Federal Reserve. And what we found is that, well, a slight majority of Americans say that they trust the FDA, the CDC, and the Department of Transportation, and a slightly less than a majority trust the VA and the Federal Reserve. There's a lot of variation across subgroups in the population. And the largest variation that we found wasn't sort of standard demographic variables that you might look at, like education level or income level or age or race and ethnicity, but was in fact political affiliation. So the gaps between Republicans and Democrats are especially prominent with the agencies dealing with public health. So the Food and Drug Administration, and even more so the CDC, where the share of Democrats who trust the CDC a great deal or a fair amount was 48 percentage points higher than the share of Americans of Republicans who do so. We also found that looking at no trust at all for the agencies, you see a similar pattern in a much higher level of distrust among Republicans than Democrats. And we do see some difference among the agencies on that no trust measure. So even though we see a little bit less high trust for the Department of Veterans Affairs, there's also less strongly held distrust of the VA. And that's also the agency where partisan political attitudes seem to have the least impact. When we look at different aspects of that trust or different ways that people may assess the agencies and in a way that would affect their trust, we found the same kind of partisan differences or differences based on political identity. In particular, Democrats are more likely to say that the different federal agencies provide an important public service and work in the best interest of the public, are guided by facts and science, and are less likely to say that they do the bidding of partisan political figures. It's interesting to see that although there are substantial differences, there's still a large share of Republicans who say that the agencies provide important public services, who see them working in the interest of the public. And there's a large share of Democrats who feel that these agencies are still beholden to partisan political figures. So there's some, you might say, equity that the agencies have to deal, still in messaging with the more conservative audiences, and a potential nascent distrust that you could see based on who the political leaders are that are overseeing federal agencies. And if we look at the COVID-19 pandemic and trust for news from CDC, we can see that story held out a little bit. So at the start of the pandemic, CDC was an agency that was in some ways similar to what we see with the VA right now, where there wasn't really much of a difference based on political identity in the trust that people had for the organization. And where we see that start to change is with the non-pharmaceutical interventions that were employed in the late March, early April period. And by summer of 2020, there was a large drop-off in the trust that Republicans had for the CDC. And it's the data that we have don't necessarily give a good indication of whether that's a specific reaction to policies, whether that's colored by or shaped more by how policies were responded to by different political actors. But it's important to note there too. We also do see a drop in trust at the same time, although less substantial, among Democrats, and that then rebounds a little bit with the election in 2020. And you could like recalling that time period, you can see a little bit of that manifested in the communications from some Democratic politicians, as in September 2020, I think, when now Vice President Harris had commented on concerns about the approval process for vaccination or for vaccines by the Trump administration. And so pointing again to that measure on the previous slide about being beholden to partisan political figures, that seems to indicate that some of this like strong trust that we see for CDC on the Democratic side is related to the like perception that it's in line with the overall administration. And so we might expect to see these attitudes change a little bit depending on how like who's in the White House. Although there is, like, given that much of the decline in Republican confidence happened during a Republican administration, that maybe you might not see as much of a change as you might expect there. One thing that we thought it would be valuable to explore, given this lack of trust, for like variation in trust for the Centers for Disease Control and Prevention, is whether their endorsement for a policy has an outsized effect on perceptions of that policy. And so we conducted a recent experiment looking at recommendations for an additional COVID-19 booster vaccination for at-risk populations, and whether attributing that recommendation to the CDC or to doctors and medical experts had an effect on the value that audiences or that the public placed on that recommendation. And so our hypothesis was that a recommendation from doctors and medical experts would be received more favorably than a recommendation from the CDC, and that this would be particularly true among Republicans. But what we found was that although there was a slight, not significant increase in the positive reception of the recommendation, in terms of people saying it was important for it to be followed, overall, there wasn't much of a change among Republicans. And in fact, the share of Republicans who said that following such a recommendation wasn't important at all increased with the endorsement of doctors and medical experts, or was higher with that endorsement. So that there's a couple potential ways of interpreting this. One would be that the attitudes about COVID-19 boosters are fixed for a very large share of the population. And so a specific endorser or messenger that is congruent with people's existing perceptions of who would endorse it and who would oppose it isn't likely to have much of an effect. Another interpretation would be that the skepticism about public health measures related to the COVID-19 pandemic is extended particularly by Republicans to medical experts as well as to federal agencies, so that it may be that the regard that people have for experts is very similar to both Democrats and Republicans, is very similar to their perceptions of the agencies, and there isn't much daylight between the two. So given what we're seeing, what can agencies do with these attitudes about trust? Well, I think the first lesson from this is that once a decline in trust occurs, it can be very difficult to reverse. So it's definitely a case where the old adage that an ounce of prevention is worth a pound of cure applies. And agencies should be especially cognizant as they're engaging in topics to prepare and communicate in a way that can try to avoid provoking some kind of reactance, although there's a caveat on that I'll get to. I think the one key lesson is to better understand what the baseline attitudes are in a given topic area. So look at where you're starting from, not just with attitudes and the context around the specific recommendation or information you're communicating, but also potential correlates of that. The example here would be, when we think about vaccination for COVID, we think, well, people's attitudes about child immunization are important, their attitudes about flu vaccination, but it's also important to look at attitudes, and we've seen this in some other research, attitudes about non-pharmaceutical interventions that were there for COVID and about broader public health measures, like wearing masks, like distance learning in schools, and those also can shape what people's attitudes are about vaccination. And then also look at how messaging is received and evaluate different messages, different communication strategies before they've acquired some kind of political salience, before it becomes a partisan political issue. The second lesson is to be transparent. So one way that we often talk about diffusing political reactance or reactance in general is using trusted messengers. But it's also important to communicate clearly about the reasoning behind the recommendations, the caveats or the concerns, rather than attempting to display maybe greater confidence than is warranted in order to avoid providing a basis for counter narratives. And so I think that's something that we've seen in some qualitative research too about what has produced some of this reactance. And then a third lesson is that there can be changes in attitudes over time, and so it's important to monitor how those are changing, especially as you're implementing a campaign, so that you can course correct, so that you can see what is working and maybe where there may be new issues that have arisen, and how perceptions like trust or perceptions of the trustworthiness of the ads and attitudes such as trust for the agency are changing, in addition to awareness of messages, the intention to change behaviors and actual behavior change. So based on that, I'm going to now hand off the mic to my colleague, Tim Smith, who can talk a little bit about some of our research on communications themselves and what makes them effective and what has made them effective.
All right. Thank you, Zach. Hi, everyone. I'm Tim Smith, and I support clients in their creative development, testing, and optimization here at Ipsos. So what role does communications play in building trust? Or, looked at another way, what role does trust play in communications? Well, from a creative lens, leveraging quant data to properly discern differences and understand what creative elements, devices, or storytelling techniques aid in delivering a clear and trusted message. It definitely provides a strong foundation for unlocking campaign potential and to learn and to highlight different ways to get there. At Ipsos, we do partner with a wide variety of clients in the communication space to harness that power. Our testing tools were specifically designed to harness the power of creativity to create impact. It's naturally in our DNA. We do this with a set of capabilities that deploy a mix of state-of-the-art methods and scientific approaches. Our breadth of experience researching and advising our clients in the communication space, it's created a wealth of knowledge for us and insights that we can often tap into to find ways of how these communications can impact audiences and best practices on how to create stronger advertising. It is this database and normative context that truly sets us apart. We often tap into our 40 plus years of experience, our thousands of ads in our database, which are across a wide array of industries and sectors. To reapply the principles, we know we can enhance impact. And part of this serves as the foundation for the insights that we'll share today. So effective communications are common across a wide range of methods and sectors. But to start, we know that in order to have a effective creative communication, it has to do two things. Obviously, we need to make sure it's capturing attention and be remembered and has that stopping power so that when a consumer or your target audience is potentially seeing it, they'll stop and remember who it is for. Viewing the ads needs to create, obviously, a change in the audience, and typically that comes in the form of behavior or perception. And it's here that where we often see influenced either positively or negatively by the levels of trust garnered from the message that's received. A powerful message, if not delivered properly, it can honestly detract from its intended effectiveness. These are things that we obviously want to strive to guide our clients through in order to make sure that they're getting the most impact. And this framework applies in the public sector, not just private as well. In fact, ad performance in our Ipsos testing system, it's been extensively proven to predict ROI in marketing mix analysis. And it's a commonly applied research technique to build and manage successful campaigns. So how do we research our ads? Well, our ad testing system does allow us to properly measure the effectiveness. So at a high level, there are three areas to note that give us a powerful understanding of the read of a potential ad. First, we have to measure the ad within an online realistic media clutter to reflect the conditions the ad will be in when it's viewed. This is done to accurately get a read on how memorable the ad will be. This distracted exposure is a key difference that sets us apart from our competition. Our impact measures are worded to the objectives of the ad, either a call to action or a particular perception that we want to be informed about. We want to influence and are measured after the research participants have seen the ad in full. And finally, we have a wide range of diagnostics to isolate strengths or areas of opportunity to provide improvements to the ad or effectively develop learnings for the future. We know that storytelling is a powerful tool, regardless of sector. One key finding from our database is that content that tells a story tends to perform well on memorability. These data on the slide represent the percent of ads in our database that fall into the top tier of the data set and segmented by the characteristics of that content. Drama and humor, conversation and ads, they're all linked to higher memorability. These represent stories and are different than ads that use other formats, say like testimonials or even montage imagery. The power of stories are deeply rooted in history as humans have learned and evolved through the verbal storytelling process. And we want to empower our clients to tap into that very thing. We could guide them along the way in that journey. The ability to leverage these learnings we've collected over time, it could offer a supportive and creative playbook of success, and this is a huge benefit to our clients. So now we'll take a look at an ad we've tested in our system that sought to inspire parents to engage in tough conversations with their teens. It's called Do the Vape Talk. It makes effective use of popular viral dance video trends, drives parents to visit talkaboutvaping.org, and for tips on when and how to have that vape talk with their kids. And it showcases the way that you tell your story has a direct impact on the effectiveness and trust in your message.
Every day, thousands of kids start vaping. And I can't let this happen to my kid. Of course, it's awkward to talk to kids about the dangers of vaping. Hey, bestie, how's sketches, vaping? It's hard to get their attention. Ready? Go. Yes. Look at that. You even turn yours over. So if you want to talk to your kids about the dangers of vaping, you got to get it trending.
No, you're doing it wrong.
Let's go.
Can we talk?
Yeah, what's up?
Visit talkaboutvaping.org for tips on when and how to have the vape talk.
So Do the Vape Talk builds trust through empathy and relatability. It tells an empathetic and relatable story of the challenges initiating important conversations with your children through a father and daughter interaction. It was able to reinforce trust with tangible see-say messages and constructive support. It blew us away when 88% of the parents we tested among felt the information was trustworthy, and it scored in the top of our database for both memorability and motivation. So, it offers a humorous and engaging storyline. It's coupled with clear message takeaways on the dangers of vaping. And additionally, it doesn't really shy away from highlighting the truth about the topic. It's very often a challenge to get our kids' attention, never mind in regards to a behavior like vaping. Some of the sentiment expressed by parents who were surveyed, as you'll see here on screen, we think sum up the sentiment. And again, it's in their own words. I thought it was a creative way to talk about something serious with my child from a dad, 52 years of age. And also, it started out with scenes I could relate to, since my teenage son is just like the girl in the video and hard to have a conversation with. So this gave some ideas how to go about getting our children's attention from a mom, 44 years of age. But we know that creative elements can have a direct impact on how successful an ad will be. When we look at another ad in our database featuring mental health awareness, comparing that with the Vape Talk ad that we just watched, we see some significant and quantifiable differences on key metrics around memorability, motivation, and relevancy. The mental health ad tested had a sentiment where people felt that, while the topic came across as important, it did create motivation to act. Some felt the music, tone, and pacing, or the scene cuts, came across as pandering, a bit distracting, and sometimes confusing for some. And it missed an opportunity to communicate the gravity of the mental health issues being discussed in the ad. As a byproduct, it did limit the perception of trust and relatability compared to that Vape Talk ad. So while the two shared similar creative tasks, our data proved that when many of the creative elements are working in sync with one another, we can observe meaningful differences that can affect desired outcomes. Specifically, authenticity is one optimization area that testing would support in this particular case. Had it been applied prior to airing, the impact this would have had on the general public could have likely been higher. So creative quality, it's a critical aspect of how we deliver impact with our advertising. And this is just as true for public health as any other category. We know that running a higher quality creative can get you 20% more impact for the same dollar investment as running an average or below average ad. So with that said, there are some best practices for us to keep in mind during the creative process. Storytelling is a tried and true way to gain attention, but we have to be careful about the storytelling techniques that are used because it could overshadow the cause, the message, things like that. The importance of authenticity and empathy for your audience cannot be understated. It helps to deliver on trust in the message, which in turn ladders to behavior and attitudinal changes. Testing and experimentation, lastly, is key to learning the best strategies and tactics that we can connect with audiences and deliver more impactful communications. Yeah, thank you for your time today. And now I'm going to pass it over to my colleague, Chris.
Greetings. Good to be with everyone. Thank you for joining us. Thanks, Tim. So I'm going to be finishing up our presentation here, and then we will be moving to the question and answer session. Again, like Ellen said at the beginning, if you do have any questions, please don't hesitate to use the Q&A field in the GoToMeeting app to log your questions in. You can do that at any time. So Zach started off the conversation talking a little bit about why the context matters, why the circumstances, the environment you're operating within matters. And then Tim went on to elaborate, talking a little bit about sort of specific tools and mechanisms to really evaluate campaign creatives, messaging, things like that to its best effect. I'm going to focus a little bit on some of the tools we have, some of the methodologies we have to do this kind of research in the environment Zach was talking about, using some of the tools Tim was talking about. And I'm going to do it using an example of a long-running partnership Ipsos has had, and that is with the Ad Council. We have been a research partner of the Ad Council since 2013. I've actually been involved with the program since almost the very beginning. And the Ad Council, if you're not familiar with it, is a very impressive organization. It is a nonprofit that is dedicated to essentially connecting organizations that are looking to do public service announcements, trying to get some sort of positive public service message out into the public with sort of creative and advertising space to get that message out. And it's a way to really sort of leverage finite budgets to sort of the best effects. But the Ad Council, does this work through a relatively complicated mechanism of remainder advertising space that's donated to them, to donated creative activity. And it's, it is a very challenging operation to run, and it's some very impressive and large things that they are trying to achieve. And they actually have a large number of campaigns that they are running at any one point in time. And this is a selection of a couple of them, but they actually have, I think, 30 different campaigns running at this particular moment in time. Again, a large number ranging across the spectrum of issues, from the venerable Smokey Bear campaign, Only You Can Prevent Forest Fires, one of their longest running. And it is Smokey Bear, it's not Smokey the Bear. I was corrected on that when I started working with them almost a decade ago. To child seat safety, to caregiver assistance, to pet adoption, anti-drunk driving or anti-drugged driving, lung cancer screening and prevention, to a whole host of other issues. And the challenge is they have all of these campaigns, these 30 different campaigns that they're trying to track with, again, relatively small budgets allocated to each one, relatively small research budgets allocated to each one. And they're doing that, like Zach said at the beginning, in an environment that is very complicated. And another factor, if we'll go to the next slide, is that they're doing that is almost like shouting into the wind, because the average expenditure in the United States on advertising is about $300 billion. Massive, massive marketplace, lots of things happening. I mean, just think of any time you've spent watching TV or driving around. Once you get attuned to it, the amount of advertising we're exposed to is mammoth. And the typical ad campaign for a public service announcement is about $1 million. For a single campaign. And honestly, that average is pulled up by a couple of relatively well-funded campaigns. Many of them actually have less. And you might not be able to see it here, but as a proportion of expenditure, there's a very tiny little yellow dot there in the bottom left corner of that 300 billion box, and that is the relative size of a $1 million ad campaign in that $300 billion advertising space that they're sort of operating within, right? So it's a challenge, right? They're running all of these campaigns, trying to change behaviors, trying to teach people things, trying to do things for good in a very, very competitive, challenging marketplace. Next slide. So one of the things, though, that we've learned is that, yes, the entire marketplace is huge. There's a lot going on, but things that are very targeted, specifically targeted to the people for whom the message is relevant, for who are dealing with these kind of situations, you can move the needle with the public service campaign. You can change behaviors or teach people something new if you're able to get really close to the audience that cares about it. And in the advertising space, it has gotten easier to do that using social media, using digital technology that allows very fine-grained targeting, using sort of commercial lists to sort of better target out-of-home advertising. You can get much closer to the ultimate target audience, the ultimate group you're trying to reach. But to evaluate the effectiveness of that campaign, the research has to actually be just as targeted, and that is traditionally proven to be a challenge, particularly when we sort of thought about research as more of a general population kind of thing, or much more broad-based population level surveys. And even if you narrowed into a specific audience, a specific group, you started to see things where you would lose efficiencies because you're essentially having to screen out large numbers of respondents to find that group of people who sort of met your criteria, driving up your costs. Next slide. So what we assembled with Ad Council, again, about a decade ago, is essentially an ongoing omnibus survey for them to track their campaigns, where we start with a sample each month of several thousand Americans. We have all of them go through a series of identification questions to essentially figure out which campaigns they would qualify for, and then we actually route them through two individual campaign modules so that we can evaluate the effectiveness of the campaign with an audience that the campaign would matter to, right? So we're not trying to ask all Americans, for instance, about forest fire prevention and people understanding what they can do to prevent forest fires. We're only asking people who visited a national park in the last 6 months. Right? But because we're doing this in an omnibus, we're actually able to keep most of our respondents because somebody is going to qualify for probably any one of the campaigns at a given time. So we can ask them if they smoke. We can ask them if they visited parks. We can ask them if they're parents, if they are a caregiver for an older relative, all sorts of other things, and then route them to a survey module for that specific campaign. So it ends up being essentially a large, complicated omnibus survey for the Ad Council to track these campaigns that we're doing over time, month over month, being able to sort of track them in a way that gives them that resolution on the audience that they want, that they need to be able to track effectiveness, but also do it in a relatively cost-effective way. Next slide. Then another alternative sort of methodological tool we've developed with Ad Council and started to deploy with Ad Council to measure this is using online probability panels for high quality research. Online probability panels, if you're not familiar, are large online panels of people who've been recruited using some sort of probabilistic methodology. The Ipsos Knowledge Panel that we run is the largest of those in the United States, though there are several other large high-quality research panels that are similar. And we use a mail survey actually to recruit people into it. So ABS, postal address thing. So essentially all households in the United States have a chance to qualify into the survey. And it is a very high quality gold standard type approach. And the nice thing about this is once we've recruited people into these panels, we do start asking them a lot of the demographic variables or even attitudinal variables that are actually ultimately of interest to these kind of public service campaigns. So then when we get a project come in that is targeting one of these groups, we don't necessarily have to start and screen down. We can actually go directly to this kind of audience to do the research and skip over part of that screening protocol that was required for campaigns in sort of the earlier sort of iteration. Now, of course, it's not full service, right? If there are some very peculiar population parameters, you may have to screen for that. It's not necessarily going to be suited for that, but for things that require sort of basic demographics, things like gender, age, education, income, geography, parental status, things like media or entertainment consumption habits, so like where they're getting their entertainment, their news, their media from, the amount of time they spend watching, what kind of things they're fans of, and then sort of health behaviors, if they have insurance, if they have what their health status is, if they have medical conditions, things like that. All of this has been identified, so we can actually go to a sample of people who would qualify for this kind of PSA that would essentially be the kind of people that we're trying to reach. So for instance, if you're running a campaign about sort of getting your cholesterol under control, we can target people that have been diagnosed with some sort of hypertension or some sort of heart disease as sort of the starting sample, the starting universe of that. And as an example of how we've done this with Ad Council is the COVID vaccination campaign. So Zach actually showed a number of slides from the research we did during the pandemic, which technically ended earlier this month, is we did help Ad Council with the campaign that they coordinated to get the vaccination effort out there, doing research with them to gauge the effectiveness of the communications campaign around the vaccination effort. And we did start with the knowledge panel as our tool to identify these audiences because it was a very high quality sample. We could be very certain of it. And we could target people based on age and the at-risk sort of health criteria that were important to understand at the early stages of the vaccination campaign. Because if you recall, at the beginning, you had to be of a certain age or you had to have certain health conditions to qualify for the vaccine in the first few months before it was opened up to the general public. So starting in the fall of 2020, before the vaccine was actually even released to the public, we started tracking behaviors, tracking attitudes towards the vaccine with the Ad Council and helped inform as a part of a much larger effort, of course. There's a lot of people involved. It was, big, very impressive effort coordinated by the Ad Council to get the vaccination out there. But we were helping inform sort of the effectiveness of that communication over time, tracking that group. And then as the vaccination qualifications changed, right, as they made it like, okay, well, it was 65 and up, then it was 55 and up, and then it was everybody. We were able to change the sample blend to include those groups as well, but also had some of those key cut out some of those key demographics that we're able to track over time to make sure that we were doing like over like. So it's just another sort of methodological approach that we're able to bring to bear to help this kind of research get done. Again, sort of using a lot of the tools that Tim just outlined for us. So what does that sort of leave us ultimately at the end of this? Well, one, it is important to not necessarily think of all of your research problems, all of your PSAs that you're trying to sort of run or your health programs that you're trying to get out there as the same. And you should be thinking about sort of bespoke, customized solutions for them that are built around sort of the specific goals of your effort. And the way to do that is first to sort of define who it is that you're trying to reach, what the problem is, what the solution that you're trying to do, and then work with a research company like Ipsos, though many of us in the industry are certainly qualified to do so, to figure out an approach, a methodology, a tool set that can best help you accomplish those goals. So that's it for me. I think Zach has a few words here at the end, and then we're going to open it up for questions. Zach?
Thanks, Chris. So We have a special way for our attendees, or some of our attendees, to do a little bit of what we talked about today, and that's understand a given issue or the context around an issue that may be important to them for their public health communications. We will work with 3 researchers selected from among today's attendees to add 5 questions, up to 5 questions, to one of our upcoming knowledge panel surveys. So 5 questions for each of those, up to 5 for each of those 3 attendees. On our knowledge panel omnibus survey to explore a health topic or public policy topic of interest. Our knowledge panel, as Chris mentioned, is a probability-based panel. All the research that we featured here today, the Ad Council campaign evaluation, the copy tests with the ads that Tim talked about, and the research that I presented, were all collected through the knowledge panel. It gives very accurate information on the attitudes of the public and behaviors of the public. And so it's a neat opportunity to understand a topic in more detail. So we should be doing be able to do the selection by the beginning of next week and follow up with some of our attendees on what they'd like to explore. So if there's any questions about that, you can ask those along with questions about our research that we've presented here in our question and answer session that starts now.
Great. So again, anyone who has a question, please log it using the Q&A field in the GoToMeetings thing, and we will go through as many questions as we have space for in the next 10 minutes or so. If we're not able to get to your question, we will send you an emailed response. So don't worry, we will be able to answer everyone. So let's see what we got. All right, here's the first question. I think this is probably for Tim. At the end of the creative presentation, you mentioned a statistic of 20% plus impact for the same investment when running a high quality creative. Can you share more about how you arrived at that number?
Yeah, thanks, Chris. Excuse me. So across categories, we've done thousands of unique validations, connecting our ad testing metrics within our system to in-market outcomes. So historically, this is usually done through marketing mix analysis from our clients, and it allows us to isolate the impact of an ad on a specific outcome. We've seen in this process, we've actually seen differences between below average ads and above average ads that are tested within our testing system show upwards of 40% in market difference in driving that outcome. Or the difference of an average to above average ad, I think is about within a 20% range. So when we talk about outcomes in the private sector, it's more about variables like sales, getting prescription signups, or even market share. But that's generally like how we've gone through that process to arrive at that.
Great, thanks, Tim. Next question, this might be a little Zach, a little Tim. You guys can sort of figure out who's best suited to answer this, but the question is, Zach referenced how important specific messengers are in communications. Are there tools like the creative evaluation for evaluating messengers? Zach, you're on mute still.
Sorry. Yeah, so when we do that formative research, before a campaign or when you're developing the strategy, I think that's the time to evaluate that. And there's a couple different ways that we can do it. I mean, asking people about who they trust when they want information, or as sort of an open-ended question, and asking sort of structured questions about how much you trust different potential sources of information are both helpful. We often pair that with a broader battery of attitudinal questions that we can then used to develop segmentation so that we can sort of categorize different segments based on what their attitudes are, and then look at, for each of those segments, who the trusted sources of information are. When you do that, then you can try to you will also understand media habits and look to sort of tailor communications to those different audiences. The one thing to be wary about with it is that information doesn't just stay with one place. Like, you wouldn't necessarily want to have a messenger targeting this group that is very distrusted by another group, because those people can encounter messages in different places, right? So like if you were, say, aiming at an older audience that trusted someone who was highly distrusted by younger, less educated people, you wouldn't necessarily be able to have the messages or that strategy avoid that other group. And so it's helpful to keep in mind the trust of other segments when you're sort of selecting who to go through. Using the pandemic as an example, there's certain groups that would trust Dr. Anthony Fauci a lot, other groups that wouldn't, but would trust President Trump more. But it's like, what is said by one and the messages coming from one are going to be perceived by the other group. And so it's important to sort of think about what the likely salience or reactance is among different segments, and even beyond those you're targeting sometimes.
Great. Tim, I think this is for you. Generally, what are the turnaround times for ad research like what you shared today?
Yeah, so that could vary. It depends, but we've structured our testing system to, depending on audience or scope, right, to be anywhere between like a 24-hour turnaround, or could even in some cases be up to 2 weeks. Again, it's variable based on the number of ads or creative that we need to evaluate the audience, so on and so forth. Typically, sometimes clients and agencies find it difficult to, inject ad research in the process and their timelines. So what we've found actually is, even if we can't do that, a lot of our clients leverage our tools in order for proper learnings for next time they're developing a campaign or set of creative.
Great, thanks. I think this one might be for you, Zach. Are there any limits on what can be used with the promotional omnibus questions? And then there's a smiley face.
In general, we cover, we're able to ask about most kinds of topics with our knowledge panel. For a given wave, we try to only cover a topic through one set of questions. So say if we're fielding some questions on COVID-19 vaccination already, and it's been scheduled for a certain wave, and that's what you wanted to explore, we may have to wait until another wave where that's not what we're covering in order to do that. But I think that would be the primary limitation. And we'd want to work just to make sure that within 5 or fewer questions, we're able to collect something that's useful and helpful in that regard. But we cover topics with our knowledge panel that can include like illegal behavior sometimes, or like questions. So I think there's relatively few limitations in that regard. It will be an 18 plus audience too, so that would be a consideration too. It wouldn't make sense if you were trying to explore like youth tobacco attitudes. That wouldn't be the place to do it, but that's more because of who is included in the knowledge panel omnibus survey.
Yep, great. All right, this next one I think is for Tim, and this is the last question we have. Where are the norms or benchmarks that you referenced coming from?
Yeah, so we have, using this approach, it's more widespread, obviously in the private sector, but we have several thousands of cases in our database that span category, segment types, and we use that always to contextualize the findings. This way, we're giving the proper benchmarking and evaluation based on your audience, based on your the creative type. Like let's say you have a TV video, or like if you have an out-of-home advertisement, like we make sure that we can kind of drill down on those specifics to give you the best contextualized understanding of how that ad's performing relative to our database.
Great, thank you. So those are all of the questions we have. I think that's it. Ellen, close us out, please.
Wow, I just really want to thank Zach, Chris, and Tim for today's really insightful presentation and the insight shared. Thank you, everyone, for joining us. Be on the lookout for a link to today's recorded presentation. That should come in the next couple of days. And remember, we've uploaded a very interesting point of view into the control panel. So I invite you to go in and download a copy of that. At any time, we welcome the opportunity to speak with you directly. So please feel free to reach out to us. That now concludes today's webinar. Have a wonderful day, everyone.